Welcome to eCancer November. This is November 2017 and it's exactly 10 years since we started ecancer.org. There's a special issue with some papers to celebrate the 10th anniversary of eCancer, and there's a short clip from me introducing them. For me, the highlights were two clinical scientists, one in Brazil, Maria Pombo de Oliveira, who's been working for all of those 10 years and at least 10 before that, studying children, neonatal kids. It's a mixture of pre-existing genetic abnormalities in these little babies and external potential carcinogens, and indeed some of these carcinogens, such as pesticides and involved in crop spraying, which is all over Brazil, have been linked to some of the pre-natal genetic abnormalities. So that's one outstanding lady scientist from the Inca Institute in Brazil. And the other is Barbara Jerosek-Fossa, who's the professor of radiation oncology at IO. And it was from IO under the leadership of Professor Umberto Veronese that he and I put the journal together. And Barbara has a couple of very interesting papers updating us on the last decade of improvements in radiation therapy. My top pick for the articles this month is the editorial, and it's really riveting. It is a mixture of on-the-spot reportage. It's graphic in its detail of the problems in Venezuela in oncology and indeed medicine. It's by Sunil Dharinyani, who's a medical oncologist in Caracas, and he is unbelievably frank about the dreadful situation in Venezuela. We see the headlines of 2,000% inflation, and we stop to wonder how on earth the healthy inhabitants of Venezuela can possibly be looked after when presumably the priority is being given to those who are in jobs and trying to improve the economy. It's a riveting read, as I say once more, and I recommend it to you. Next we have a follow-on article in our series on repurposing drugs, and this is a nice little review on chloroquine and hydroxychloroquine, well known as anti-malarial agents. And this is a short review of the evidence that there may be some sort of relevance for these two anti-malarial drugs in the management of various different cancers. Then there's a nice paper from Agarwal in the Tata Memorial Hospital in Mumbai, and his team have been looking at a patient derived score, comparing it in a prospective fashion with the Karnofsky index. And it's really probably unsurprising for those of you who follow the many articles we've published in eCancer about the importance of the patient and listening to the patient and having the patient's voice. And you'll not be surprised to know that the patient-derived score is just as good as the Karnofsky in any of the various parameters that they looked at. For those of you who are surgical oncologists, there's a nice little paper from Minig talking about the subphrenic approach to getting lymph nodes removed in patients who've got advanced ovarian cancer. It's way beyond my understanding. It's using new technique to get at the cardiophrenic lymph nodes. An interesting read, and non-surgical oncologists like me should read it and understand it. For those of you who wonder what CDK4, CDK6 is all about in breast cancer, lots of new drugs hitting the headlines, palbociclib, ribociclib, and there's a real interest in the results of randomized trials where these CD4/6 agents have been added to aromatase inhibitors, producing a considerably significant prolongation of progression-free survival. And these are patients who have got estrogen receptor positive breast cancer, metastatic usually or locally advanced. really very important, so important that we decided to develop 3 education modules, for 2 for physicians and 1 for cancer nurses. So I commend you to take some time out, they're not very long. When you've got some time to spare, just go onto them and then you'll know all about why it's exciting to have these new drugs targeted to CDK4 and 6 in advanced breast cancer patients. We have, as always, a whole series of new videos, and the one that I'd like to highlight the most prominently is a discussion which was led by Heather Payne with 3 colleagues, and discussing the new way that urologists are now treating prostate cancer, which is resistant to the conventional androgen deprivation therapy. We've talked about this before, and there are several articles in ecancer about this, but this, I think, is one of the best roundtable discussions that we've produced, and is coming out very, very clearly with guidelines, I think, which should really be being adopted very, very quickly throughout the world. This is patients with prostate cancer resistant to ADT, or beginning before they even have ADT, to have ADT along with a cytotoxic drug like docetaxel. A lot of interesting studies going on looking at abiraterone up front with ADT. Really a big, big shift in urological opinion, and some very, very strong trials to back it up. That's it for November. You'll be glad to hear that I'm not going to sing happy birthday to ecancer.org, and I'll speak to you around the Christmas time. Have a good time. Bye.